Welcome back, everybody, for another deep dive.
hmm
This time we're looking at a really important skill for nurses, and that's psychiatric interviewing.
Oh, yeah.
And we're going to be pulling our insights today from the book Psychiatric Interviewing, The Art of Understanding by Shawn Christopher Shea.
It's a good one.
Really good one. I think for folks who are listening, you might think, well, psychiatric interviewing, that's not really relevant to me.
Yeah.
But really understanding how to get to the root of someone's concerns, how to understand what they're experiencing, and how to kind of tease that out of them, that's relevant no matter who you're working with. Even if you're not directly working with patients, I think we can all benefit from this.
Yeah, absolutely. And this book really emphasizes that, like you were saying, it's about really understanding the person. And he uses this concept called the human matrix. Have you heard of that?
Yes, I have.
Yeah, so it's basically this framework for recognizing that a patient, any patient, is this like tapestry of biological, psychological, social, familial, cultural, all of these things coming together. It's not just about a diagnosis, it's about the whole system.
Yeah, it's like it really makes me think of like that movie, The Matrix, right? Where
hmm
it's like you see this interconnected web of information and how one little thing over here can affect something way over there, and it's really complex. I like that way of thinking about it.
Absolutely. So if you have a patient coming in with anxiety, for example, you're not just looking at the anxiety symptoms in a vacuum. You're thinking, okay, what's their medical history? What's going on in their family? Are they stressed at work? What's their cultural background? Like all of these pieces of the puzzle are coming together to create their experience.
And you know what? I'm realizing that even though this book is focused on psychiatry, and we're talking about it from the lens of nurses, I mean, this human matrix idea, this is like something you can apply to anyone you're interacting with, whether it's a coworker or a family member or even just like someone you meet at the grocery store. If you can kind of keep that in mind, it can make your interactions so much more understanding and productive.
Definitely. And it makes you wonder, how many times have we gotten things wrong because we haven't taken that whole picture into account?
Oh, all the time. And speaking of things we can get wrong, have you ever had those conversations where, like, somebody's words are saying one thing, but their body language is telling you a totally different story?
Oh my gosh, all the time. It's like that classic example someone says, I'm fine, but their tone and their face is like the opposite of fine.
Yeah, or they're like fidgeting and can't
Mm.
make eye contact. She talks about this, right? The importance of nonverbal communication.
Huge emphasis on it, especially for nurses. Being able to pick up on those nonverbal cues is crucial because sometimes what a patient isn't saying is just as important as what they are saying. You got to pay attention to posture, eye contact, tone of voice, how much they're fidgeting, all of that.
There's this one example in the book that really stuck with me. He talks about a patient whose words were all calm and collected, but they were fidgeting like crazy, avoiding eye contact, and their voice was all shaky. And it turned out they were absolutely terrified, but trying so hard to hide it. Like, imagine if the nurse had just taken their words at face value.
That's such a good point. We're trained to listen to what our patients say, obviously, but how they say it, that's a goldmine of information. She calls those nonverbal cues regulators, and he says they can be real indicators of someone's comfort level and their true engagement.
Yeah, it's like those regulators are giving you a glimpse into what's happening beneath the surface. And that's something all of us, whether we're nurses or not, can start paying attention to in our own interactions.
Yeah.
Just noticing those subtle shifts in body language or speech patterns
Mhm.
can tell you so much about how someone is really feeling.
For sure. It's like a whole secret language we can learn to decode, and once you start seeing it, you can't unsee it.
Okay, so we've got the human matrix to remind us to look at the whole person, not just the symptoms. And now we've got nonverbal cues to help us understand what's not being said. Where do we go from there?
Well, Shea takes us into the world of empathy next, but not just any kind of empathy. He calls it strategic empathy.
Strategic empathy. Okay. I'm intrigued. What makes it strategic?
It's about tailoring your empathy to the individual patient and their specific situation. Cause sometimes, believe it or not, too much empathy can actually backfire, especially with patients who are guarded or paranoid.
Hmm. That's interesting. I guess I've never really thought about it that way, but it makes sense. I've definitely been in situations where I've tried to be super empathetic, and it just felt intrusive or awkward. Like I was trying too hard. So how do you get this strategic empathy right?
Shades gives this great example. He's working with this patient who's really paranoid, right? So instead of saying something like, I can only imagine how terrifying that must be, which could actually feel threatening to someone in that state, he goes for a more measured approach. Something like, that sounds like a really difficult situation.
Oh, that's so subtle, but so important. It acknowledges the person's experience without kind of amplifying their fear. I can see how that would be so helpful, especially for nurses who are dealing with patients who are in really vulnerable states.
Exactly. It's
Yeah.
about meeting the patient where they are emotionally and responding in a way that feels safe and genuine, not overwhelming.
Okay, I'm starting to see how these pieces fit together. Instead of going in with my own assumptions and biases, I can use these tools to really understand where the patient is coming from.
It's like you're becoming a detective, but instead of solving a crime, you're solving the mystery of this person's experience.
I like that, a detective of the human experience. And speaking of mysteries, how does Shai recommend approaching those sensitive topics that patients might be hesitant to talk about, like trauma, abuse, or suicidal thoughts? Those things that can be really tough to bring up.
You're right, those are heavy topics, but they're often at the heart of what's going on. And Shai stresses how crucial it is to create a safe space for the patient to share those things. It's about building trust, being patient, and using very specific techniques.
So what kind of techniques are we talking about?
Well, he talks about this idea of shame attenuation. It's basically acknowledging that these experiences are more common than people realize. So instead of making the patient feel isolated and alone with their shame, you're kind of normalizing it.
You're saying, hey, you're not the only one who's gone through this.
Exactly. He also talks about gentle assumption as a way to open the door to those tough conversations. So instead of asking directly, are you being abused? You might say, sometimes when people are in difficult situations, they experience. You're kind of planting the seed without being confrontational.
Ah, that's so clever. It gives them a way to talk about it without feeling like they're being interrogated or judged.
Hmm.
I can see how that would be especially helpful in a nursing setting, like in the ER or a busy clinic where you might not have a ton of time to build that deep rapport.
Totally. It's about meeting the patient where they are and respecting their pace. And these techniques, I think, they're not just for therapists. They're helpful in any situation where you need to build trust and encourage open communication.
Definitely. Whether you're dealing with a patient, a coworker, or even a family member, those principles can really make a difference.
Now, I have to ask, have you ever had those moments where you thought you understood someone perfectly, but then realized your own cultural assumptions were totally clouding your judgment?
Oh, absolutely. I had this one experience. I completely misinterpreted a patient's behavior because I wasn't aware of a certain cultural norm. You have a huge learning experience, but it definitely made me realize how much my own background can influence my perceptions. She talks about that, right? The whole cultural aspect of the interview process.
Big time. He argues that cultural background shapes how we perceive the world, how we express ourselves, even how we experience illness. So, what might seem like a typical presentation in one culture could mean something totally different in another.
So how do we navigate that as nurses? It's impossible to be an expert on every culture.
He talks about the importance of cultural humility, basically recognizing that our own cultural lens is always there and it's going to color how we see things. So it's about being open to learning about different cultural perspectives and constantly checking our assumptions.
It's about asking questions and being genuinely curious rather than assuming we know everything.
He gives a great example of this. There's this phenomenon called ataque de nervios. It's found in some Latinx cultures, and it can involve intense emotional distress, shouting, crying, trembling, even fainting.
Wow.
Right? Now, to someone who's not familiar with that, it might look like a panic attack, but it's actually rooted in specific cultural beliefs and experiences.
That's a powerful example of how important it is to be aware of cultural differences.
Yeah.
And it makes me think all these tools we've been talking about, the human matrix, nonverbal cues, strategic empathy, techniques for unlocking those hidden issues, and now this crucial reminder about cultural sensitivity. It's like we're building this amazing toolkit for understanding the whole person.
Absolutely. And this is just the tip of the iceberg.
Yeah.
She goes into so much more detail about specific techniques for guiding the conversation, managing time, even dealing with those challenging patients who might push your buttons.
Okay, I'm already so excited to dig deeper. This is like a masterclass in building those strong, trusting relationships that are so essential for effective nursing care.
Right. And it's not just for nurses. This stuff is valuable for anyone who wants to connect with people on a deeper level.
So stay tuned, everyone, because this deep dive is just getting started. We've got a lot more ground to cover and a ton more practical tips to uncover.
Welcome back, everyone. Last time we started exploring Shay's really fascinating approach to psychiatric interviewing and how it can help nurses specifically build stronger connections with their patients. We talked about the human matrix, nonverbal communication, strategic empathy.
Oh, yeah. It's like we were opening up this whole new toolkit for understanding and interacting with patients on like a deeper level.
Totally. So are you ready to add some more tools to that kit?
Oh, absolutely. I am so ready.
All right, great. Well, Shea dives into some really practical techniques for gathering information effectively. And one that really stood out to me is this idea of behavioral incidents.
Okay, behavioral incidents. I like the sound of that. What exactly are we talking about here?
So think about it this way. Instead of just hearing a patient say, I get anxious sometimes, you'd ask them, can you tell me about a specific time when you felt anxious? What happened? What was going through your mind? What were you feeling in your body? You're really trying to get those concrete details.
Oh, okay, I see. So instead of those vague generalities, you're getting them to give you like a real life example.
Exactly. And Shea gives a great example of this. Instead of a patient saying, I get really angry sometimes, you might ask for a behavioral incident, and they might say, well, last week I got so mad at my boss that I slammed my fist on the table and stormed out of the meeting.
Oh, wow. Yeah, that paints a much clearer picture, doesn't it?
Totally. And you can start to see, like, the triggers, the intensity of their emotions, maybe even the potential consequences of their behavior.
It's like you're zooming in on a specific scene. Instead of just looking at a blurry photograph, you're getting all those
Mhm.
details, the colors, the textures.
It's like you're right there in the moment with them. And this ties back to the human matrix, too, because those behavioral incidents can give you clues about all those underlying psychological, social, maybe even cultural factors that could be contributing to the behavior.
Okay, so we've got these behavioral incidents to help us get a clearer picture. What other techniques does she recommend?
He talks about something called gentle confrontation. Now, I know that might sound a little intimidating.
Yeah, confrontation doesn't exactly scream gentle to me.
Right, but it's not about being aggressive or judgmental at all. It's more about uh, pointing out those discrepancies or inconsistencies in the patient's story, but doing it in a way that feels collaborative and respectful.
So it's more like, hey, I'm noticing a couple of things that don't quite add up. Can we maybe explore this a bit more together?
Yeah, exactly. Shea emphasizes framing it as a team effort. You might say, I'm a little confused. You mentioned feeling hopeless, but you also talked about being excited about this new project. Can you help me understand how those two things fit together for you?
That's a much less threatening approach than saying you're contradicting yourself.
Right, and it really encourages that open communication and builds trust.
For sure. So we've got behavioral incidents and gentle confrontation. What else is in this toolkit?
Okay, well, another area where nurses can really make a difference is in assessing a patient's mental status.
Okay, that sounds important. What exactly are we looking for when we do that?
It's about observing their appearance, their behavior, mood, affect, their speech patterns, how their thought processes seem to be working, even their insight into their own situation. It's like you're taking their mental temperature.
So you're not just listening to what they're saying, but you're paying attention to how they're saying it, how they're acting, how they're presenting themselves.
Exactly. And those nonverbal cues, remember those regulators we talked about? They can be super revealing, sometimes even more than what the patient is actually saying.
Can you give us an example of what kinds of things to look for?
Sure. Let's say you have a patient who's describing a really traumatic experience, but their affect is flat, meaning they're not showing any emotion. That discrepancy could be a big red flag suggesting that something more serious might be going on, like severe depression or PTSD.
Oh, wow. So it's like their words and their emotions aren't matching up, so that's a sign that something might be off.
Right. Another example is a patient's thought process. Like if their speech is all over the place, they're jumping from topic to topic, their thoughts are kind of jumbled, that could indicate disorganized thinking, which can be a symptom of various conditions.
Okay, this mental status assessment, this is starting to sound like a really powerful tool.
Oh, it definitely is. And the more you practice, the more tuned you become to those subtle nuances that can really give you a window into the patient's mental state.
It's like you're becoming a mental health detective.
Exactly. You're putting all the pieces together to get a clearer picture of what's really going on.
Now, speaking of sensitive topics, how does Shea recommend approaching, suicide risks? That's got to be one of the toughest conversations to have.
Oh, absolutely. And he stresses that clear, direct communication is key.
Hmm.
It's so important to not beat around the bush. It's okay to ask directly, are you having thoughts of suicide? Or have you ever tried to hurt yourself?
Oh, gosh, that sounds terrifying to ask.
It can be, for sure. But avoiding the topic isn't going to help anyone. You're not putting the thought in their head by asking.
Right. I guess it's better to address it head on.
Exactly. And remember, you're not alone in this. If you're feeling unsure or overwhelmed, you can always reach out to a supervisor, a mental health professional, or a crisis hotline. There are resources available to help you navigate those difficult conversations and ensure the safety of your patient.
Okay, that's reassuring.
Mm.
It's a heavy responsibility, but knowing that there's support available definitely makes a difference. Now, one of the things I really appreciate about Shea's book is how he brings these concepts to life through real-life examples.
Oh, me too. Those case studies are so helpful. They make it much easier to see how these ideas actually play out in the real world.
Right, they ground all this theory in actual experience.
Exactly. He tells this story about a young woman named Sarah who's struggling with depression and anxiety. And as he's working with her, Shea uncovers this whole history of trauma and abuse that's really contributing to her current struggles.
So it's like another example of the human matrix, right?
Yeah.
Those past experiences are still impacting her present.
Totally. And Shea uses all those tools we've been talking about, empathy, validation, even humor sometimes, to create a safe space for Sarah to really open up. And as she feels more understood and supported, she starts to engage more in the therapy process.
It's such a powerful example of how transformative the psychiatric interview can be when it's done right. It's not just about asking questions, it's about forging that genuine human connection that allows healing to begin.
Beautifully said. And all of this, it can be so demanding both emotionally and mentally for the nurse, and Shea doesn't shy away from that at all.
You're so right. It's easy to get burnt out in this field, especially when you're dealing with such heavy stuff day in and day out.
He actually dedicates a whole section to self-care, which I think is so important. He reminds us that to really take care of our patients, we have to take care of ourselves too.
It's like that whole put your oxygen mask on first thing.
Right.
You can't be fully present and effective for others if you're running on empty yourself.
Exactly. Now, I know we've been singing the praises of Shea's book, but we also need to acknowledge that real life is messy, right?
You mean things don't always go as smoothly as they do in the textbook?
Sadly, no. But Shea does a great job of addressing those challenges, and we're going to tackle some of them head on next time.
We're talking about those difficult patients, those crazy, chaotic environments, all those curveballs that nurses face every single day.
Oh yeah, get ready for it. We're going to equip you with even more tools and strategies to navigate those tricky situations, so stay tuned.
All right, welcome back to our deep dive into psychiatric interviewing with Shawn Christopher Shea's amazing book.
Yes, psychiatric interviewing. The art of understanding has been giving us so much to think about.
It really has. We've covered so much ground already, from that whole human matrix concept to nonverbal cues, strategic empathy, and all those really practical techniques for unlocking those sensitive topics.
Yeah, and last time we even touched on how to handle some of those real-world challenges, like those tough patients or those super hectic environments that can make this work so difficult.
Absolutely. But there's one piece of the puzzle that we haven't really explored yet, and that's personality disorders.
Oh, yeah, that's a big one. And for nurses especially, you're often the one spending the most time with patients, so you're in this unique position to pick up on those patterns of behavior.
That's true. But personality disorders, those could be kind of tricky, right? Like, where do we even begin?
Well, she cautions against what he calls label slapping. Like, don't jump to conclusions just based on a few observations.
Right, makes sense.
It's important to take a thorough history, observe the patient over time, and consider all those different aspects of the human matrix.
So it's not about, like, diagnosing them on the spot. It's more about recognizing those patterns and how they might be affecting the patient's care.
Exactly. And remember, personality traits, they exist on a spectrum. Not everyone who displays certain traits actually has a full-blown personality disorder.
Okay, that's good to remember.
It's about recognizing when those traits become really inflexible, maladaptive, and are causing significant distress or impairment in the patient's life.
So how can we start to wrap our heads around all these different personality disorders? There are so many.
Well, she does a good job of breaking them down into clusters.
Okay, yeah, that's helpful.
There's that dramatic and emotional cluster. That includes borderline, histrionic, narcissistic, and antisocial personality disorders.
Okay.
Then there's the anxious and fearful cluster with avoidant, dependent, and obsessive compulsive personality disorders. And lastly, you've got the odd and eccentric cluster, including schizotypal, schizoid, and paranoid personality disorders.
Okay, that does help to organize things a bit. But how would these actually show up in our interactions with patients?
Well, let's take borderline personality disorder as an example. Shea describes how these patients can be very intense, emotionally volatile, like they might have this real fear of abandonment, and
Wow.
they might have unstable relationships, struggle with impulsivity.
So as nurses, we might see them reacting really strongly to even small changes in routine or like perceived slights.
Exactly. Now, think about a patient with obsessive compulsive personality disorder. They might be very rigid, controlling, perfectionistic.
Uh-oh.
Right. They might have a really hard time relaxing.
I can see how that could create some challenges in a healthcare setting, especially if they're trying to control every aspect of their care.
Absolutely. It can be tricky. But Shay does offer some really practical tips for working with patients who have personality
Okay,
disorders.
good. I was hoping he would.
He emphasizes setting boundaries, maintaining a professional demeanor, and not getting pulled into their drama.
That sounds way easier said than done, especially when you're trying to, be empathetic and build that therapeutic relationship.
It's a balancing act for sure, but it's important to remember that you're not there to be their friend or fix their personality. Your role is to provide care and support within the boundaries of your professional role.
Right. And that's where communication with the rest of the treatment team comes in, right?
Absolutely. Collaboration is key. Personality disorders often require a multidisciplinary approach, so it's important to share your observations, communicate clearly with the therapists, psychiatrists, social workers, everyone involved.
Yeah, like everyone's working together to support the patient from different angles.
Exactly. And remember, you're not alone in this. If you're ever feeling overwhelmed or unsure about how to handle a situation, reach out to a supervisor or mental health professional for guidance.
It's good to have that reminder. You know,
Yeah,
we all need support sometimes, especially in a field as demanding as this.
for sure. And, we've talked a lot about these specific techniques and challenges, but I think it's important to step back and remember that at the end of the day, this work is all about real people with real struggles.
You're so right. It's easy to get caught up in the diagnoses and all those techniques and forget that we're interacting with human beings who are hurting and in need of our help.
Exactly. And that's what I love about Shea's book. He brings that human element back into focus. He reminds us that the psychiatric interview, when it's done with empathy, compassion, and skill, it can be such a powerful tool for healing.
Yeah, it's not just about gathering information. It's about creating a space for understanding, connection, and hope.
And that's what makes this work so challenging, so rewarding, and so incredibly important.
I feel like we've really gone deep on this one. From the human matrix to nonverbal cues to all those practical techniques, Shea's book is just packed with insights.
And the best part is, it's also applicable to nursing practice.
Hmm.
No matter where you're working, whether it's a psych unit, an ER, a clinic, even in home health, these skills can help you connect with your patients on a much deeper level.
I know I'm walking away with a whole new perspective, a renewed sense of purpose, and a ton of practical tools I can start using right away.
Me too. And I hope our listeners are feeling the same. We'd love to hear your thoughts on what resonated with you most, what you're curious to learn more about, share your experiences, your insights, and let's keep this conversation going.
And remember, everyone, this is just the beginning of your journey into the art of understanding. Keep learning, keep growing, and keep connecting with your patients in a truly meaningful way. Until next time, take care.